All right, hi everybody, Dr. Eric Herman, Guru Chiropractor here, and this is my patient James Kim.
Yes.
Say hello to the camera. Some people might recognize him. I'll let him tell you his background.
Yeah, I'm a martial artist. I've been doing it for a long time, and did a couple of different shows in the past, doing some stunt work, choreographing, working with Steven Segal and the likes of like Chuck Norris. Great martial artists in the past.
Back in the 80s, right?
Yes,
Where,
yes,
man,
the 80s.
It was really awesome.
All the way till the 90s, they've been very good, yeah.
Him and his brother, he has a twin brother. They're known as the Tiger Twins.
Yes.
You can look them up on the internet.
Awesome.
Cool stuff. So James found me on the internet. He's coming in for a few different issues. He does have lower back stuff too, but that's not the big issue right now. He's having acid reflux, or what's called GERD, right? So I do a technique. It's not a direct treatment for acid reflux. I just want to make that very clear. I am not qualified. I'm not a stomach doctor, but sometimes indirectly it could help fix the underlying cause. What we're going to do today is we're going to do a diaphragmatic release. The diaphragm is the muscle that helps us breathe, but it also has tubes coming through it, including the esophagus, which is the tube that goes from the throat all the way and dumps the food into the stomach. If the diaphragm gets spasmed, which it can because it's a muscle, that what's called the hiatus can't open up properly or enough, and sometimes the food can't get all the way into the stomach. It sits on top and starts to ferment. This is one theory of what causes acid reflux. And then the acid comes back up, right? So what we're going to do is just release the diaphragm, and if that is the cause of his problem, he should get some results. Now, I want to tell you, this is his second visit. He came in about a week ago, right?
Yeah,
and we did a first visit, and he came back, and so far there's been no real improvement with the...
Not a real improvement, but definitely you loosened up my neck and my back with that, what is it called?
The ring digger decompression.
Wow. That's something else.
Yeah. So back and spine are doing better, and I think we're going to do another one of those today too.
Yeah, absolutely.
And I'm going to show you the diaphragmatic release, and hopefully maybe one more we'll do a little deeper. Plus I'm going to do a couple acupressure points that also help give better energy to the digestive system. Hopefully that'll also help. At this point, the honest truth is I don't know, but I'm going to give it my best shot for him because he's here and he drove a long way to come see me, so we're going to roll right into it and we're going to give it our best shot. Okay, so here we go. You ready?
Let's do it.
Face down first.
Okay, this way. Right.
We're going to check a few things coming out of camera. So you're not getting any symptoms down the legs though, right? Lately?
No, not really.
Good.
Feeling pretty good with that.
And that was since you had a shot though, right?
Yeah, I had a shot, but also I think the last time you really loosened it up too.
Okay, so since last time it's been better.
Yeah.
That's good to know. Is there pressure in your lower back
Not
when
really,
I'm doing this?
Not as much as the last time.
The last time, yeah, because I have in my notes that you were complaining of a lot of tension when I bent.
Yeah.
So you've kept some improvement, which is good for the back.
Uh-huh.
Okay. Now I'm going to press down on your tailbone one at a time. Start with this leg. Lift it as high as you can. Go. All right. Good. Now try the other side. Okay, and good. So they went up, but not as high as they could. Do you feel they were kind of tight?
A little bit on the sides, probably.
Yeah, like here?
Yeah.
These muscles are tight, which that indicates the sacroiliac is not functioning or moving as well as it could. I mean, I know you're a Taekwondo master, so you should be able to kick the ceiling right now, right? You should be able to like kick a 6-foot guy in the face.
It was a lot easier 10 years ago.
I hear you. All right, so we're going to do some more releasing here. Neck feels okay. Still a little tension on the left side of your neck. And you know what? Here, this area sends nerve supply, to the upper GI, esophagus, and stomach. So just wondering, anything sore or tender when I'm pushing here?
Just a little, right?
Like, right here?
Right there,
Yeah. That's, let's see, 7, 8, T4, yep, that goes right to the stomach, some of the neurology. So we're gonna release that too. Hey, the more energy we could send to the organs, the better their chance that they're gonna function at a higher level. So I'm just gonna loosen you up. And what we're gonna do is, we're gonna go right in for the ring dinger first. And then when we come back here, we'll finish off anything else that needs to get adjusted. And then when you roll over, we're gonna do the diaphragm release. And that extra pressure point treatment. And we'll see how you do. Just a little stretch, a little warming up the muscles. Okay. All right. Good. Okay, come on up on your feet, and we're going right in the room directly to the Don't trip coming through. Okay, head here, face up for me. Okay, I'm going to feel the top of the hips. Okay, so come down about 2-3 inches. Right, one more. Right there. Perfect. Just a reminder, this has got to be tight. So we're going to pin you in pretty good. Good. Look, I wore out the pads.
Oh, wow.
From doing too many pulls. But I just got new ones in the mail, so I'm going to replace them. Can you handle that pressure?
Oh, wow, that's tight.
Yes, yeah.
It's good. I guess that's what we need, right?
The tighter, the better release you'll get. So if you can handle it, give me your wrist back behind. I'm just going to pull out any slack. Perfect. Yeah, you're really good. Now the table's going to come up and raise up your legs. Good. Nice. Get my towel prepped.
Feels like a roller coaster ride, but it happens in split seconds.
Yeah. How about some people have commented they feel like they're in the space shuttle ready to launch to the moon.
Yeah, that's.
If I hit the right button, we're going right through the ceiling with this thing. All right, lift up your head, please, sir. Thank you. Come on down. So again, another little reminder. This is going to be tight here, but it shouldn't be choking you. Okay. And your job: keep your teeth secure together, but don't bite super hard. Just secure, so when I pull, you don't chip a tooth. Everything else, stay as relaxed as you can get. Okay. Here we go. Teeth together. Stay relaxed. Everything loose. Relax, relax, relax. And boom. Oh. Felt it?
Yep.
I can tell by how you reacted. That's good. Trust me, this is so good for your back.
Yeah, especially you feel it down here on the bottom.
Yeah, and that's where you have you. Hold on, stay there. I mean, I'll lower it, but I want to check your neck right from here. That's where your major problems are, right? You have some herniations down in the lower lumbars. Let me see how the neck is doing. Good. Stay loose. Nice one there. Good. And let it go. There. Good. Okay. Done here, so when you're ready, come on up on your feet again. Oh, good? He's even taller now. God at it. Come on. Come on. Here. All right, and when you're ready, go face back down on there. Rest your hands on the sides again. What was the movie that you were in with Steven Segal?
Oh, Exit Wounds?
Exit Wounds. I gotta look that up. I think it's probably on Netflix. I gotta watch that again.
We tried to steal his truck and,
You and your brother together?
yes.
How come I don't... I mean, I'm a big martial arts movie fan and I've studied, but I My memory sucks. I have to rewatch it. I probably haven't seen that movie in like 10 years or more.
Yeah, it's been a while.
Okay. Ben, I know you said it was good already, but still good, right? In the lower back?
Yeah. Feels good.
Excellent. Now we're going to do a little more drop down here to release some more lumbar fixations and the sacroiliac joint and some of this tension in here.
Yeah.
Stay loose. Nice. Good. Stay relaxed. Nice. Good. There it goes. Perfect. A little bit more release in the sacroiliacs. Just want to see if this is any better. Try to lift this high up as you could go. Yeah, it went up a little higher. Try this side. Good. All right. To me, it looked a little more freely coming up and a little more range of motion. Yes.
Yes.
Right, good. Now we're going to work through the thoracic area. Again, this also is related to the esophagus and the stomach, nerve-wise, neurologically. Relax. Relax. Good. Stay loose. Good. Relax. Nice. Okay. Now I want you to look straight up to the sky. Tilt your head sideways. Let it go. Let it go. There. Good. All you crack addicts, did you hear that one?
Oh yeah, I
That
felt
was a popper. Again, look up side. Stay loose. Good. Back to you. Better there. Better there. Okay. Now, here's where it was sore before. Is it still sore here when I poke?
Less.
Less sore. But still a little bit?
Mm-hmm.
One more drop. For good luck. Stay loose. Up. I gotta tighten it. Stay loose. There. Good. Alright. Now roll over on your back. Good. Now we're going to do the release. If you remember, I'm going to have you take a deep breath in, and then as you exhale, I'm going to do down this way and down towards your feet. That's going to be the line of drive. If something bothers you, these are some weird ribs. I'd love to see an X-ray of that. They go up really high. Okay, so ready? Take a deep breath in. Exhale out slow. Let it go. Stay loose. You handling that? And relax. Is that painful?
I feel it. Definitely feels deep, you know.
You want it deeper this time, so I'm going.
Yeah, I gotta feel it.
Again, deep breath in. Exhale out slow. Let it go. And relax. Take a couple normal breaths. Last one. Deep breath in. Exhale out. Let it go. Let it go. Let it go. Let it go. Good. And breathe and relax. Now I brought my other massager in that has the soft tip on it. I didn't do this last time, right?
I don't think so.
Yeah, because I had the wrong massager here. This has a very soft tip.
Yeah.
And if you're okay with that, I'm going to get in underneath the ribs with this
Sure.
and really release both sides.
Sounds great.
Get ready for some very interesting sensations. Nobody
don't-
likes it, but
Don't tickle me though.
don't use. If you need me to stop, use words, not karate chops, please.
Yeah,
Don't be messing with me here. Just stay relaxed. It's intense. Chinese medicine talks about the organs and how they're related to many other things other than just their normal function. And in Chinese medicine, they talk about the diaphragm being related to emotions.
Feels great. That machine really feels good.
Yeah, it's really getting in with a nice vibration. If there is any kinks, any spasms in the diaphragm, this is going to get it out. So if that's the underlying cause of your GERD, I'm expecting this to help. Good. Coming on the other side. This is just generally getting at the other, you know, the diaphragm wraps all the way around. But your underneath here is your liver and your gallbladder, so might be a little more uncomfortable. You okay? Some people feel like a warm, itchy sensation when it starts to release. Okay, and I don't know if you can handle this, but can you handle the ribs?
Sure.
Because we're going to just go on top a little bit. Just release anything here. It's all connected to the diaphragm. Getting rid of any abnormal tension. Would you? I mean, you're on camera, so I don't know if you want to say, but I'll ask you off camera. I wanted to ask you what you thought of Steven Segal. Good guy?
Yeah, that feels good. Great.
Is he the real deal as far as martial artist?
Oh, absolutely, yeah.
I always liked him. You know, his moves look real. They look very efficient. The Aikido that he does and all that. Is it Aikido or Hapkido?
Aikido.
Yeah. Japanese, right?
Oh, that feels good too, right around that.
All the connective tissue. Connects everything all the way down. And then up here is the thymus. There's a thymus release. But that's part for the throat too. Underneath the collarbone. You okay? Oh,
I just have to I don't, you know, maybe it's just my throat, but I just have to swallow.
Did it feel like it got like...
No, that's fine. That's good. It was just
If you need to throw up, I got the thing.
No.
But do it on camera, because a lot of people are going to want to watch that.
no. It felt really great. No, it felt like it was really loosening up this whole section over here where my shoulder is, because I've always had some issues with the shoulder from training. You know, back in the days. I don't know whether I threw there might have been dislocation of the shoulder one time.
Yeah.
But it feels good. It feels really good.
Okay.
It's just loosened up everything.
Cool. Well, a couple more things. Go back on your back. So back face up again.
Okay, face up.
Yep. Now there's it's a pretty major acupuncture point, acupressure point.
Yeah.
My memory stinks. I can't remember the name of it, but the way to find it is you go to the knee,
Right.
and the meaty part of the knee, the lateral part of the leg,
Yeah.
this muscle here, which is called the anterior tibialis.
Right.
You come up here and you find that bump on where the knee starts, and then it should be like 3 fingers down from there, and then you feel for a sore spot. So if there's something sore here,
Yeah, it feels sore.
feel sore?
Right there, yeah.
Okay, Now, I want to see which side is more sore because you're supposed to do really both, but the one that's the most sore is the dominant. Which side's more sore, here
I think the left
or the
side,
other side?
Yeah,
Here, right
one,
here?
Yeah.
Right there?
Yeah.
Okay,
it's really
so I'm
tight.
just going to rub this out. If you can't handle
Yeah.
the pressure, let me know, but it's going to be vigorous for about 20-30 seconds. I'm not even kidding. I've done this on myself and many other patients, and sometimes the results are
No,
instantaneous.
it feels really good.
Instantaneous, just to like get rid of stomach upset, indigestion.
Wow, yeah, that's a great
irregularities.
pressure point there.
I can't. I suck at names. I can't remember the name of it, but if you look it up,
You can feel it's kind of tight there, right? I mean,
Yeah.
you can feel that. Yeah, that
and the
muscle-
fact that it's sore means,
Yeah.
according to Chinese medicine philosophy, that there is a blockage and and that's definitely affecting your digestive system. So hopefully doing this is going to just release more energy to be able to be
Acupressure,
utilized by your digestion.
Yeah.
Which shit, can't go wrong there. Energy is the most important resource the body needs. Period, end of conversation. Nothing else is more important.
Yeah,
We're
right
gonna do
there.
a little bit
Wow.
more on this side. Tell me where it's sore.
Yeah.
Lower?
A little low. Yeah. Right around there. Yeah. Right there. Yeah. Got it. So both legs. That has to be.
The points on both sides,
Yeah.
usually you want to go for the side that's sore, but if both sides are sore, you want to stimulate both sides.
Yes.
So now listen, if this helps you,
Right. Right.
you could use this now self-care
Right.
anytime you want. Just feel for the soreness
Yeah.
down there and rub it out. Good. Good.
Great.
Okay, a couple more things. I'm going to do some releasing of the collarbones and the rib cage.
Okay.
Screw your body down a couple more inches. One more.
I think I'm growing. You made me longer.
Arms out. Good. We're going to release the collarbone with a drop and then some of the ribs. Stay loose. Good. Good. Relax. Nice. All right, hands back up there. You can do a little tug for your ankles and your knees.
Gotcha.
Drop it and flop it. Nice. Come on, relax. Good. Okay. Now I'm done laying, so come on up, sit up, swing around. Now, you're saying this shoulder was the shoulder you've had problems with?
Yeah, it's been pretty tight. I think over the years, I might have done something to throw it out a little bit, and
Nothing diagnosed or nothing repaired in here, no surgeries
no,
or nothing?
nothing like that.
All right, let me just see. You let me move it. Let me
Yeah,
just
yeah.
see the range of motion.
Gotcha.
Yeah, see,
Yeah,
it's
see
tight.
right there, it's tight. Yeah.
Right, coming back.
Yeah, it's probably part of frozen shoulder too.
Yeah, this one's definitely better. It's a little restricted, but not nearly as bad.
Yeah.
Let me see if there's any strength imbalances. So take this arm, bring it straight out this way. I'm gonna push down.
Uh-huh.
When I do, resist me if you can. Ready? I'm trying to get the angle for Steve. All right, ready? Push up. Good. Any pain?
Yeah, a little bit.
A little bit.
Yeah.
Now bring in front. Hold here. Don't let me push down. That feels solid.
Yeah,
Any pain?
no pain, no
Turn your palm up. Keep your elbows straight. Push up. Any pain?
Nope.
Okay, one more. Here and palm towards me, and don't let me pull forward.
Okay.
Push back.
Yeah, I feel
Oh,
this.
see how you got?
Yeah, it's all back there, wherever that rotator cuff is.
Yep.
I think that's where the pain is.
Okay, so I'm going to do a couple more pressure points to see if that helps. Okay? So the top one here is for the shoulder, in the front and the back. Around T3, T4, anterior and posterior. Sore up here?
Yeah, a little bit. Yeah. Yeah.
And then a little lower here, T7, T8 for the posterior, which was actually the medial trapezius muscle, which was weak when I pulled it forward.
Right.
And think that's Steven Segal calling. He's telling me, I heard you've been talking about me. Saying good stuff? Yes. Yes, we are.
Yeah, no, he's a great martial artist. Just his Aikido is.
Because he went over, he actually trained in Japan, right?
Oh, yeah,
he got like the real promotions from the
Yeah.
real senseis in Japan, right?
Absolutely, absolutely. You can't get to his level. I mean, where he's at, not knowing his stuff. He's unbelievable. He showed me a lot of good, great techniques.
I love watching his
Yeah.
movies. All right, let's see if that made any difference. So bring here, and again, don't let me push down. Ready?
Okay.
Up. It locks better. Does it
Yeah,
feel different?
Yeah, it feels stronger.
Beautiful. Now look here, and don't let me pull forward. Push back.
Yeah.
Stronger?
Yep.
Okay. Couple more things, and then we're done. I'm going to actually adjust the shoulder joint, the elbows, and the wrists. So coming around. Take this bend. I'm coming around and hugging you. Bring your elbow down. Keep your fist away from your face. Stay loose. There.
Right there.
Now let's see.
Felt that.
Got any more? Oh look.
Yeah.
To me it feels a little more flexible.
Oh yeah.
And it's definitely stronger. That's good. Bend here. And release. Relax rather. Relax. Good. That one not so bad. Let me check your elbow here. Drop it. Good. Check your wrist. Floppy wrist. Good. 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 Pull back towards yourself. All right. After we're done, you got to throw a kick for the camera. I want to see you do a spinning hook kick over my head. Can you do it? No, I don't want to.
If I break a couple of these lights, is it okay?
It's all right. It's all right. I won't
This
charge
place
you.
is pretty tight.
I won't charge you. Relax. Good. Feel that one go?
Great.
Pull.
Yeah.
Pull. Good. Good. Okay, so pretty much that's all I did. That's a very complete treatment.
I feel good now.
Woo! Look at that. You the man.
All right.
Listen, I'm praying and I'm holding highest intentions for that to do better for you.
I hope so too.
I
Yeah,
hope.
yeah. I
hope it
think
does.
I definitely feel a difference from the last time to now. So I think I get the improvement over here for sure.
Yeah, your back is
Wow.
doing great. I could
That,
confidently say your back's much better.
That ring
This-
finger, man, that thing is
It's the joint, it's
something
the
else.
bomb.
I think everybody should experience it. Did he do it?
Many times.
Oh, you did? Okay.
Many times.
Great, great.
Yeah.
And you know what it feels like.
Yeah. So,
Thanks.
if you need me again, you know what to do. Good luck with
Absolutely.
everything else. And this is the Guru Chiropractor signing off with Big Kim over here.
One last
Tiger Kim. Wah! If you need me, reach out. Ring Dinger. Yeah, I can't even talk.
Yeah.
RetroChiropractic.com is my website, has everything on there. Or you could reach out to my assistant Zach at 908-224-3080, text only. He'll help you with any questions, and if you want to make an appointment, he'll help you out with that too. God bless you. See you soon. Love you guys.
Awesome.